Hi everybody, my name is Jessica Flaherty and I did my final project on 3M Company. So some background information for 3M is that they were founded in 1902. They were originally called 3M because they were the Minnesota Mining and Manufacturing Company, so basically the 3Ms. The company was originally involved in mining a mineral deposit for grinding wheel abrasives. 3M is a provider of consumer industrial goods. They supply things ranging from office supplies to medical supplies, healthcare manufacturing, auto manufacturing, oil and gas, and more. And if you don't think you own a 3M product, you probably do. So, what is needed due to COVID 19? So, 3M as a medical supplier supplies the masks that all healthcare professionals and personnel wear on a daily basis. Due to fears of the virus, stores were quickly sold out of the masks needed, therefore causing stockouts across the U.S. Gloves were also needed during this pandemic for healthcare professionals and personnel. Gloves were sold out almost immediately as people felt safer with gloves, so they took it for their stockpiles at home, leaving healthcare professionals with a lower stock. Cleaning supplies were now on the rise due to the virus. 3M sells bulk cleaning chemicals and disinfectants as well, which I didn't know before doing this product. And due to everything with COVID 19, it made it harder for individuals to continue to be safe because of all of these people hoarding the supplies and everything else. So, disruptions to their supply chain. So, there's an excessive demand for personal protective equipment or PPE. So, 3M is one of the biggest suppliers of necessary PPE like the N95 mask, which we've all heard about in the news and just from our friends and family. Healthcare professionals need equipment. So, due to the general public's hoarding of supplies like masks and gloves, PPE inventory was significantly lower than previously, as they do not hold these in massive stockpiles. Normally, there is nowhere near the demand for this equipment, therefore, they don't hold it in massive stockpiles. Healthcare professionals use a different mask per patient to avoid cross contamination, and due to the low supply, healthcare professionals are rationing their masks and reusing them. They are using the same mask for all of the patients each shift, and they're bringing the different germs around the hospital. They are now disinfecting their N95 masks after each shift with blue light to get rid of the germs. And each person gets about one mask a week. Usually, 3M gets orders from these different hospitals and different healthcare organizations maybe a few times a year, and they know that these orders are typically the same like from year to year. So that's why they don't keep it in massive inventory, because they know that they're going to get an order for this and then they're going to make the product for that order or prepare for the order a little bit beforehand as well, if they have like kind of a reoccurring amount of orders every few months. So back in January, there was a restructuring which caused layoffs. So before the virus spread rapidly around the US, 3M laid off 1,500 workers globally due to a restructuring that they were going to try to do for this past year. So they were already starting off the year with a lower workforce, and with this global pandemic that hit, they did not have as many workers as they did the year previously. There's also a lot of price gouging and deceptive sales across the US. Amazon has been trying to stop this as well on their website. If people are price gouging hand sanitizer or soap or mask and gloves, they do try to take it off of their website. So there are a lot of people on the internet that are scamming individuals by selling deceptive masks and also charging a higher ticket price for them because they know that people will buy it. And 3M is actually filing lawsuits against these people to do better for their customers. So, changes due to COVID 19. 3M has increased their productions of N95 masks. In January, they went to maximum production of the N95 masks that doubled their global output of 1.1 billion or 10 million per month. 3M now only supplies their masks to specific people. So 90% of their N95 masks go to healthcare professionals. The other 10% is spread across the two other essential industries like energy, food, and the pharmaceutical industry. Now, the Defensive Production Act, or DPA, was invoked. So 3M now has to prioritize their mask orders from FEMA due to a government order, which that if they're prioritizing that and say they order million, which they have, it makes it a little harder for 3M to deliver those masks to the specific people in the healthcare industry, but FEMA is also doing that as well. I know this past week they did say that this current order will be going to the people in nursing homes, so that's pretty nice. 3M has also done a lot of donations. So far, they have donated $5 billion to research funds for the COVID-19 relief. So, for sustaining production after this, 3M will have to continue making these masks. So, they were going to have to make sure that their production capacity and raw materials are accessible and in stock. 3M will have to continue to distribute masks. Um, Unsure of when the DPA will end, they will have to continue their maximum capacity production to meet the requirements set by the government administration. And then they're going to have to prepare for a second wave. The WHO, or the World Health Organization, is predicting the second wave of the COVID-19 virus that will happen in the fall. This could be another, the same COVID-19 virus, but they doubt that that will happen. It will probably be a different strand of the COVID-19 virus. So they are going to have to prepare their production of these masks for that second wave. And even after this virus goes away during the summer months, they're still going to have to continue their production to stock up for that second wave, and also to get all of those masks that were stocked out of hospitals back in the hospitals. So they're going to have to refill all of their orders. Some of my post COVID-19 predictions is that scaling back on their production could cause layoffs of workers, as there is no longer a huge need for them. And by doing this, 3M could be in trouble should there be a third wave or a new virus. So, holding inventory, 3M will most likely decide to keep more inventory of these masks and medical supplies on hand in the near future. And this could cause more inventory holding costs, warehouses, and space costs, like etc. And then inventory replenishment. As demand for the N95 masks fall, 3M will be able to refocus on producing more of their other products and replenish inventory at retail stores. So 3M they make a lot of pens, they make post-it notes, and right now, even though that's not a huge need, there are people that are still buying those products, like office supplies, and just people now that at home they have to make their home office more like their actual office, so they have to buy these supplies. So a lot of stores like Staples and Best Buy and even the dollar store are probably running very low on this stock. And since 3M has been only producing masks for the last few weeks, they definitely are falling behind on their inventory of these other products, nor are they probably shipping that out anyway to their suppliers, just because that isn't a priority for the world right now. So that's all I have for my presentation. I hope you guys enjoyed listening to what I had to say about 3M, and I hope you guys learned something, and I hope you all are staying safe and healthy with your families. Bye.